basis. And that applies whatever state you might be in. So that's the thing about federal law. It's usually a question of how many employees do you have, not what state are you in. Now I'm going to focus on some things that are definitely state-specific. And so, again, I can't get as specific from state to state as I might like, and I would with a specific company if they were saying, what do we do in Minnesota? What do we do in Alabama? Because they could be very different answers. But I want to talk about, in general, what effect this has on workers' compensation. I said very, very state-specific. In general, though, here's what's going on with it. In general, most legislatures are saying we don't want to encourage or reward people who are using drugs illegally or using alcohol while they're working and manage to get hurt as a result. We don't think it's fair to make the employer pay for that or pay for all of it. So in general, a positive test may result in sometimes a reduction or a complete disqualification for getting any kind of work comp benefits. And often that decision of whether it's just a reduction or a complete disqualification will depend on, is it just a positive drug test, which I said earlier may not tell us anything about current impairment. It just tells us they have the presence of drugs. And that may be enough to reduce their benefits. Oftentimes the states will say, if you can prove that you didn't just have the illegal drugs present, or the drugs illegally present in your body at the time of the accident, but that you actually caused the accident, that use, whether it's alcohol or drugs, caused the accident, that's when they may lose those benefits entirely. And again, that's the difference. That may go hand in hand with your decision about what substances should we test, what specimens do we use, because you can bolster your argument if it's a real-time saliva or real-time blood, or that would tell you much more definitively